another important topic which I'll be talking about, that is peripheral artery disease. Peripheral artery disease, you have to understand here, is a narrowing of the vessels which are away from the heart, that are periphery to the heart. Means to say, narrowing of the vessels, especially in the lower limbs, either it can be femoral artery, or it can be popliteal artery, or a tibial artery, or in the upper limbs like brachial artery, radial artery. So these are the peripheral artery, we can say. So any atherosclerotic process in these arteries, we call it as peripheral artery disease. So both peripheral artery disease and coronary artery disease are caused by atherosclerosis. Atherosclerosis means the plaque which is developed within the vessels due to the deposition of the cholesterol and fats and other substances, what we call it as atherosclerotic plaque. So in peripheral disease, atherosclerosis in peripheral artery, we call it as peripheral artery disease. So usually what happens, this atherosclerosis, it narrows and blocks the arteries in critical region of the body. So the quick facts about the peripheral artery disease is that the most common symptom of peripheral artery disease involving lower extremity is claudication. Claudication means whenever the patient somebody is walking, he develops pain in the legs. When he takes rest, the pain disappears. This is a classical, what we call as claudication in medical terminology. This is one of the classical presentation of the peripheral artery disease. So whenever the patient is walking, he develops pain in the legs. When he takes rest, the pain disappears. This is what we call as claudication, or sometimes the patient develops a cramping pain in the lower limbs, or while he's climbing upstairs, or he's while walking. So they develop the pain in the cramps or in the hip muscles sometimes. So typically the pain goes away with rest and returns when the patient again walks. If the disease is very severe, they can develop even gangrene, or sometimes even amputation is required. So most common cause for again peripheral artery disease is smoking, is one of the most associated factor with the peripheral artery disease. So it is advisable to stop smoking completely. Suppose if there is a narrowing of the lesion in one particular part, that can be managed by intervention, that is by stenting. So by stenting, the blockage can be removed completely and the pain can be relieved significantly. So how to control a peripheral artery disease? One thing is that follow your doctor's recommendation and strive to lead a healthy lifestyle. And if you are a smoker, you stop it completely. Early the treatment is better. The more delayed, the chances of amputation and chances of limb completely losing a limb is one of the major issue. So some cases of PAD can be managed just with the lifestyle modification and medications also. So to say the peripheral artery disease is most commonly affects in the lower limbs, but we can also see in the axillary artery, brachial artery, in the upper limbs also, and best managed by lifestyle modifications. Once it develops critical lesion, then the patient may require a stenting or the bypass grafts to the particular artery. Thank you very much.